In this lecture, we turn to one of the most fascinating and misunderstood stages of sleep, REM sleep, rapid eye movement sleep. REM sleep is where the brain looks awake, the body is immobilized, and the mind becomes vividly alive. Although it makes up only about 20-25% of total sleep time, REM sleep plays an outsized role in emotional health, creativity, learning, and psychological integration. When REM sleep occurs, REM sleep does not occur immediately after falling asleep. It typically begins 70 to 90 minutes after sleep onset, following a progression through the non-REM stages. Across the night, early sleep cycles are NREM heavy, dominated by deep and stable sleep. Later sleep cycles become increasingly REM dominant. By the final third of the night, REM periods can last 30 to 60 minutes at a time. This timing is not accidental. It reflects different biological priorities at different points in the night. The paradox of REM sleep. REM sleep is often described as paradoxical sleep, and for good reason. During REM, the brain is highly active. The body is almost completely paralyzed. Conscious awareness is offline. Internal experience is vivid and immersive. In many ways, REM sleep resembles waking consciousness trapped inside a sleeping body. Key features of REM sleep. Let's examine the defining characteristics of REM sleep one by one. Rapid eye movements. As the name suggests, REM sleep is marked by rapid, jerking eye movements beneath closed eyelids. These movements are not random, often correlate with dream imagery, reflect active visual and emotional processing. Although the eyes move, no visual input is entering the brain. The activity is internally generated. This reinforces the idea that REM sleep is a state of internal simulation, not external perception. Muscle, atonia. The paralyzed body. One of the most critical and protective features of REM sleep is muscle atonia. During REM, voluntary skeletal muscles are almost completely inhibited. Only essential muscles, such as those controlling breathing and eye movement, remain active. This paralysis is produced by the brainstem and serves a vital function. It prevents the sleeper from physically acting out dreams. When this mechanism fails, as in REM sleep behavior disorder, individuals may talk, kick, punch, or run during dreams, place themselves and others at risk. Muscle atonia is not a flaw, it is a safety system, a highly active brain. Electroencephalogram recordings show that REM sleep brain activity closely resembles wakefulness. During REM, the cortex's highly active emotional and visual regions are especially engaged. Logical executive regions are comparatively down-regulated. This explains why dreams can feel emotionally intense, visually rich, illogical, or bizarre. The brain is active, but without the full oversight of rational control. Vivid dreaming. REM sleep is the stage most strongly associated with vivid narrative dreaming. Dreams during REM tend to be emotionally charged, story-like visual, and immersive. Rather than random noise, dreaming appears to reflect memory integration, emotional processing, simulation of social and environmental scenarios. Dreaming is not merely entertainment, it is cognitive and emotional work. Why REM sleep is essential. REM sleep plays a critical role in several core psychological processes. Emotional processing. REM sleep helps the brain process emotionally charged experiences, reduce emotional reactivity, integrate difficult or traumatic memories. Disrupted REM sleep is strongly associated with depression, anxiety disorders, PTSD. In many ways, REM sleep allows the brain to revisit emotional material in a safer, regulated environment. Creativity and insight. REM sleep is also linked to creative problem-solving, novel associations, insight-based learning. Because logical constraints are loosened, the brain can connect distant ideas, reorganize information, generate new perspectives. This is why insights and creative breakthroughs often follow a good night's sleep. Procedural memory. REM sleep supports procedural memory, the memory for skills and habits. This includes motor learning language patterns. Complex sequences of behavior tasks learned during the day are often refined and stabilized during REM sleep. Sleep architecture matters. One of the most important takeaways about REM sleep is this: not all sleep is equal across the night. Early night sleep prioritizes NREM and physical restoration. Late night sleep prioritizes REM and psychological integration. This means going to bed late or waking early disproportionately reduces REM sleep. Chronic REM deprivation undermines emotional regulation and learning. Sleep timing is just as important as sleep duration. Closing summary: REM sleep is a state of intense brain activity, a time of vivid dreaming, essential for emotional health, creativity, and skill learning. It represents the brain's effort to make sense of experience, regulate emotion, and prepare the mind for waking life.